This is not a prison. It's a hospital emergency room. No crime was committed. The only crime is the way we respond to individuals placed under a temporary detention order who are experiencing a mental health crisis. Because of staffing issues and a critical shortage of inpatient psychiatric facilities, countless people needing mental health treatment are boarded in emergency rooms under police custody each day, handcuffed while they wait for help. Those ordered for treatment can be held for 72 hours while staff search for an available bed, often without any treatment until they are finally released. Their trust in the system is forever shattered. The trauma they experience cannot be erased, and public safety is compromised as officers must remain with these patients until the detention order expires or until the person is finally discharged from the emergency room. This is not the answer. Ironically, the Emergency Medical Treatment and Labor Act, or EMTALA, requires hospitals to provide emergency medical treatment to anyone seeking care regardless of their insurance status. Because of this, they have become the de facto psychiatric hospital system for those experiencing a mental health crisis. Yet state hospitals are not held to the same standard. In response to the increased number of behavioral health emergencies being managed in private hospitals around the state, legislation for alternative transportation was enacted in 2018. The goal? To reduce stigma and trauma by eliminating police involvement and the use of restraint during transport for those under a temporary detention order. But what about the critical 72 hours while they wait for a bed? To address the issues plaguing our behavioral health system, Governor Youngkin's Right Help, Right Now plan promised Virginians a transformational shift in the way mental health services are managed by ensuring that people in crisis had someone to contact, someone to respond, and a safe place for help. This is not a safe place for help. Creating behavioral health urgent care centers that provide rapid stabilization and specialized care in a restorative environment, and equipping our emergency rooms with enclosed, supervised therapeutic pods designed specifically for mental health patients are better alternatives that will lead to better outcomes. It will also free up beds at our state hospitals for those who require a higher level of inpatient care but must now wait for days shackled without treatment while their condition worsens. Together, we can ensure the humane and compassionate treatment of those experiencing a mental health emergency. Contact your local legislators right now and remind them that the safe place for help is in an environment of healing where trained behavioral health professionals can offer support, because mental health crises should be handled with care, not with handcuffs.